Hello and welcome to this edition of the eClinicalWorks podcast. I'm Adam Siladi and we're broadcasting from the eClinicalWorks National Conference in Orlando, Florida. With me today is Dr. Scott Michener, CMO and practicing urologist at Comanche County Memorial Hospital. Welcome to the show.
Thanks for having me.
So eClinicalWorks, as we've seen from this conference and the keynote that Girish gave, is always trying to be at the forefront of technology, always trying to offer new things, and that has led us to some collaborative relationships in the development of our 10i acute care module. And you have a lot of experience with that as one of our collaborative partners, don't you?
I do.
So tell us a little bit about the hospital and your group.
We're a 240-bed community hospital in southwest Oklahoma, nonprofit. We have about 270 physicians on staff. We have a 100-man employed physician group, multi-specialty. We do a level 3 trauma, cardiac, neurosurgery, kind of a basic, regular, good old American community hospital.
And we've been working very closely with you to develop that 10i system and improve the offerings there. Tell me how you got to be involved with that collaborative relationship.
Well, we came to ECW on the outpatient side in 2011. At that time, I met Janesh Gandhi, one of the people in sales at the time. We took our group live either late 2011, early 2012. Janesh and I became friends over the years and kept in touch. He would often check on me, and through these conferences, we just kind of kept in touch. He told me about 2 years ago they were going to start working on a hospital system. We had some interest in it then, and over the years had been communicating about it. Last year at this conference, we saw a brief demo on that and kind of took off from there, and at the end of 15, we became a collaborative partner on the 10i project. So.
Wonderful. So what has that collaborative relationship been like? What's it been like to work closely with the developers and the team?
ECW has really treated us as a partner. It's been a partnership. We've had a team from ECW at our facility every week probably for the last year, working on all aspects. Basically, it was a real open relationship. We just kind of opened the doors of the hospital and gave them access to all our experts in various areas. They've had us to Boston. We've had some of our nurses to Boston, and it's been a real work in progress. We've seen things that are suggestions that have come to fruition in the medical record, and the engineers solve our pain points. It's been real nice. So,
excuse me. So when we're talking about your go live, what do you think that will look like? I mean, it's a large undertaking, a lot of development going on. Are you planning to phase this in, or is this going to happen all at once?
Well, we've talked about that a lot. There's pros and cons to both. We are live on a system now, and I feel like that living in two different systems isn't probably the best for the patient, and it's hard on the nurses, hard on the staff. So our plan is to, in phase 1, to take all the big areas up in the first phase. That'll be ER, med-surg, labor and delivery, recovery. So essentially we'll do what kind of the big bang and bring everything up at one time.
Well, I'm sure in a setting like an acute care setting, there's so many different things that interact that you probably have to do it all kind of together.
This is pharmacy, it's lab, it's surgery, it's labor and delivery, it's allied health, RT, PT, nursing, it's ER. It's a big undertaking.
So what are some of the, obviously there's a reason for change, right? A reason for change to try to improve what our experience is. What are some of the pain points that you're trying to resolve by moving to an eClinicalWorks integrated acute care system?
Well, right now we have, for our community, we're a big system, and we have 5 different EMRs, and not one of the different EMRs talk. We have We have an inpatient EMR. We have a cancer EMR at our cancer center. We have, eClinical Works in a big multi-specialty group. And there's no communication between the two, and there's no communication between the physicians and the hospital. So really our biggest goal is to have one unified record. We'll be on one platform. There'll be one health record for the patients that see us. It'll be a continuum of care from the outpatient to the inpatient to rehab to wherever our patients go. And so we're really excited about that. The physicians will be able to see their records and share their records better. And so really the biggest pain point we're going to fix is too many systems, bringing it down to one. So.
And how do you think 10i will do that? What do you think you'll see?
I can't speak for the computer side of it, but we're going to be one record. My outpatient record and my inpatient record is truly going to be one record, one platform. We've talked about just with a click of a button, you can go from the outpatient to the inpatient record. So when a patient leaves an office and goes to the ER doc will see their record. When they leave the ER and go to surgery or the hospitalist, they'll have their record. And when they go back to their primary care, the primary care will have the hospital record. So it really truly will be one unified record. Yeah.
Sure.
Yeah.
And I'm sure that'll make a lot of those coordination of care measures and focuses that are becoming more part of the delivering care much easier, right? If you do have to do a follow-up after a patient gets hospitalized, now you'll be able to see that they were hospitalized much more easily.
The possibility of scheduling and seeing that. Today we saw in one of the demonstrations, we saw real-time quality metrics where you can look at a dashboard for the day and follow your patient in the hospital and can make sure that they're meeting the necessary best practices and quality metrics. So it's going to be transformative for our institution, I really feel like.
Is there a role that you see for technology in general in terms of medical care and what you give to the patients?
You mean besides like doctors don't like it very much? Yeah.
Well, I think one of the big catchwords right now is patient safety. I mean, it was a big part of Girish's keynote this year at the conference. Do you think it's going to have any kind of an effect on that?
Yeah, well, I think our medication errors go down. I think that you have to, Dr. Raj talks about the patient safety being a three-legged stool, the electronic record, the best practice or the governance of that electronic technology, and then the end user, the nurses, the physicians. And so, we all have to work together, and that's kind of some of the stuff we're doing with ECW is we're trying to be a part of developing best practices and sharing those best practices so we can all take better care of the patients at the end of the day.
What about the feedback and the interaction between eClinical Works and your group during the development of this?
Well, so it's been really an amazing process to watch. We're healthcare providers, and eClinical Works is a lot of engineers, and engineers tend to solve problems, and healthcare workers tend to take care of patients. And so, what we've done is we put some of our best people with those engineers, and they just spent days with them. They've spent days in surgery, they've spent days on the floor, they've spent days in PT, they spent hours in the pharmacy, in the lab. And so if we communicate correctly to them, then they transform that into problem solving and making a record. And so it's been fun to watch. Our staff has really enjoyed it because they spend that time with them, and then 3 months later they come back and show them what they've created for them to make their day better and take better care of patients. So it's been a real nice process.
Now, I know this is a project that eClinical Works Management is very invested in and excited about, and I think you had a couple story to share about that.
So eClinical, Girish and Dr. Raj came to our community hospital to tour and see us, and I was walking with them up on the floor. We were up on the nurses' floor and up on the med-surg floor, and one of our nurse managers was walking, and I introduced them, And she started right away telling him what she wanted in the medical record. Hey, I forgot to tell you something. I want this, I want that, I want this. And Garish got a big kick out of it because he saw how motivated and how passionate she was about the change and about making it better. And so it was real nice. So.
Well, we're certainly excited to be going on this journey with you, and we hope we can get a chance to see a lot more of that coming up in the future. Now, you are also part of the patient safety panel with Dr. Raj this year's conference, right?
Which has been real nice. ECW developed a physician advisory committee for patient safety. It's very well represented. It has a pediatrician on there. It has a geriatric physician on there. It has a very knowledgeable pharmacist on there. It has some of the 10I group, a surgeon. And so really we're trying to help ECW through all their other partnerships just get out the best practice, and try to shoot for that goal of zero patient harm and really just do the best we can by our patients and using technology to do that. So.
Are there any discussions or maybe attendee questions that stood out for you from that session?
Oh, a lot. It's all mostly the medication reconciliation and medication management. Being safer in what we prescribe. But we also talked just about a culture of safety and having it as at the forefront of everything we do. It's hard. Medicine trying to take the variability out of medicine. So we do the same thing and provide the best for our patients. And that's hard when there's so many variables in the game. But it's been a good journey so far. So.
Well, I'm sure the attendees of your panel were grateful to be able to learn from your vast experience. I think we have a panel session just about every session of today's schedule, so be sure to check those out. And if you join us for our conference next year, you can definitely learn from a lot of those. Dr. Michener, thank you so much for being here today. We want to thank you for your time and your insights.
Appreciate the opportunity.
And be sure to watch our other podcast episodes on iTunes, YouTube, and on my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Siladi. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.